My name is Shahriar Khatiri. I am one of the survivors of the 1980s Iran-Iraq war, chemical warfare. My background is medicine and toxicology. It's been like 25 years that I've been working with an NGO in my country, providing support for survivors of chemical warfare. It's called Chemical Warfare Victims Association / Tehran Peace Museum. Actually, the Peace Museum was established by this Survivors Association in order to raise awareness about the horrors of chemical warfare and consequences of the use of chemical weapons. And also like a forum for survivors to come together and that they share their experience. It's a part of the social rehabilitation for the victims. So the survivors are trained to volunteer for the Peace Museum as volunteer guides and then share their experience with the visitors. But there are currently more than 65,000 people who are suffering from long-term health effect of exposure to chemical warfare agents, mainly sulfur mustard. But according to the United Nations report, around 600 tons of sarin was also used by former Iraqi regime against Iranians, civilians and soldiers, and 1,800 tons of sulfur mustard. So it's a huge amount of chemical warfare, and many survivors are not registered even. But those who are registered by the government and are eligible for receiving pension and medical services are about 65,000. So that population are under full coverage, medical insurance coverage by the government. Each and every of them, from those who have the minimum percentage of disability, which is 5%, to the maximum disability percentage, which is 70%, they are under full medical insurance coverage. So which means that all their medical services are free of charge in the medical centers, including medication, surgery, visits, equipment, blah, blah. Not only the survivors themselves, but also their family members are also covered by this medical insurance. They also receive a monthly pension dependent on their disability percentage. So the more disability percentage, the more pension that they receive.
How much would it be?
Well, it really depends. Those who are unemployed, they receive more. At the same time, it's like the salary of like a teacher with like 20 years of experience.
Okay.
Almost the same level. They receive
So
the
meaning
pension.
that they were helped to maintain the middle class
Exactly.
lifestyle.
Yes,
Okay?
almost the same. So they receive the pension, but also those who need more support at home, there is a pension for their wives as well. It's called nursing pension.
I see.
Because, for example, if I'm a survivor, my wife has to care about me all the time. So there is also another additional pension for my wife.
Wow.
And then there are also some privileges for their children. For example, priority to go to the university, priority to be recruited in the government or for the governmental jobs, priority to receive like loans for their home. Also, they receive like housing services from the government. These are the services that they receive. Also, if they need to be like admitted in the nursing care service houses, there are nursing houses that they can be admitted there to stay for long time. Yeah.
How do you see the Tokyo subway sarin gas attack at Matsumoto sarin gas attack? That's not maybe it could be an internal war, but how do you see from your point of view? Like, is that yeah?
You mean from about the survivors?
In terms of the incident.
Or the incident?
Yeah.
Well, yeah. When I teach the lessons learned from the chemical attacks in the past to the audience during my training courses or students, I always talk about Tokyo sarin attack in Tokyo subway, and it's a very unique and sad incident. We should learn lessons about that because we haven't had such incident in other countries. So that could be one of the incident that can be used for raising awareness against chemical warfare agents, and also the survivors can also be utilized as the messengers for peace, so that they can spread the message that, look, these are the horrors of chemical weapons. They can be used anywhere else in the world. So they are the examples that they, by sharing their story, they can raise awareness. But I don't really know details of the services that they receive, but what I heard from some of the friends and colleagues, I know that many of them are not registered by the government, and I'm not sure if they receive enough medical services. Yeah.
Do you want to have an exhibition over Tokyo?
Yes, in the Peace Museum, actually, we organize temporary exhibitions about the use of chemical weapons in other countries. For example, we had one together with the municipality of Ypres in Belgium about the First World War gas attacks in my country. Together with the Vietnamese embassy, we had one about the use of Agent Orange in Vietnam during the 60s. And then we are very much interested to, we have already had exhibition about the Hiroshima and Nagasaki atomic bomb attack with the support of Japanese embassy and Japanese NPOs in the Peace Museum in Tehran. So we very much would like to have an exhibition about the Tokyo subway sarin attack in Tehran, especially on the anniversary in March, so that we have some posters, even some testimonies of the survivors, videos, so that people, young generation who come to visit the museum, know about this incident. And this will be somehow like a public awareness raising to prevent the repeat of these incidents in the future.
Thank you. I hope that the Japanese government will help you.
I hope so.
Thank you.
Thank you.